Assalamu alaikum viewers and friends. This is Dr. Farah here now today again with a very informative and very hot topic. Every time, everywhere, just seen and just called as PCOs. Yeah, polycystic ovaries. Well, friends, PCOs or polycystic ovaries, this is a hormonal disorder and it is very common in women infertility age, यानी कि starting from 12 and 13 years onwards up to late 40s. And in this what happens that there are infrequent periods or prolonged periods or massive menorrhagia or dysmenorrhea, and these all defects are basically due to the excess of male androgen hormones and in the body, and these are secreted by the ovaries themselves. And what happens that the ovaries they develop a small cystic fluid filled sacs in them, which are called as the small cysts, and this results in the failure of ovulation. So polycystic ovaries or PCOS, it results in obesity or overweight and increased hair distribution, which is also called as hirsutism. It can be seen more on the face, on the upper lips and on the sides of the face, and even chest and pubic hair distribution also. And in PCOS, patients can also develop acne, and in long term infertility is also a very crucial and complicated outcome. Patients can develop type 2 diabetes and hypertension, yeah, high blood pressure, and high cholesterol is also seen. It's called as hyperlipidemia. All these complications and are basically due to not treating PCOS or polycystic ovaries. Now how can we see that a patient is having a polycystic ovary, or the lady or the female is suffering from PCOS? Viewers and friends, the basic diagnostic criteria is an ultrasound, an abdominal ultrasound, a lower abdominal scan, or a transvaginal scan. It can lead to the diagnosis that the lady or the female is having PCOS. A physical examination and the history, especially the distribution of hair, the weight checkup, all these can lead to, and hormonal assay also, which reveals that the patient is having increased levels of male hormones. Now what is the remedy of PCOS? Viewers, इसमें जो सबसे ज़्यादा ज़रूरी है basically is to if the patient is having overweight or obesity, the basic point or the first line of treatment is to guide the patient to reduce weight. And it can be by a physical workout, combination of physical workout or exercise plus diet, and plus all these reforms are called as lifestyle modifications. Until and unless we do a lifestyle modification, PCOs are totally untreatable. PCOS का कॉज पता नहीं है किस वजह से हो जाता है, एंड समटाइम्स दे रिजॉल्व देमसेल्व्स, खुद ब खुद ठीक हो जाता है. और अगर आप लाइफस्टाइल मॉडिफाई करें अपनी, यानी कि आपके खाने का तरीका, आपकी एक्सरसाइज, आपकी एक्टिविटीज़, हर चीज़ डिपेंड करती है. यू शुड हैव अ वेरी गुड मेडिटेरेनियन और अ वेजिटेरियन डाइट. आप मीट भी ले सकते हैं, लेकिन फैब्रिकेटेड मीट और फ्रोज़न मीट और ये सारी चीज़ें प्रोहिबिटेड होती हैं. यू शुड रिमेन क्लोजेस्ट टू नेचुरल फूड, और जितना ज़्यादा आप अपने फूड में नेचुरल आइटम्स को इंट्रोड्यूस करेंगे और गुड फूड लेंगे, एज़ फॉर एग्ज़ाम्पल अ मेडिटेरेनियन डाइट, उतना ज़्यादा PCOS को आप हैंडल करना आसान होगा. सो इसको अगर आप ट्रीट ना करें, इट कैन लीड टू इनफर्टिलिटी. एंड आपका हीमोग्लोबिन बच्चियों का बराबर होना बहुत इम्पॉर्टेंट है. द गर्ल्स और एंड द वुमेन शुडंट एट ऑल बी न्यूट्रिशनली deficient. So viewers, this was a very brief explanation and a review of PCOS. Hope you enjoyed my video. For having much more, you like my YouTube channel and subscribe karen. And until the next one, this is Dr. Farah signing off. Take care of yourself and your family. Assalamu alaikum.